As the U.S. grapples with the youth mental health crisis, a study finds an interesting approach to better well-being.
Children and teenagers who volunteer in their community don't just help others. They may also be improving their own health. Michael George met a teenager knitting her way to happiness.
That's a down one.
Penelope Segerdahl is learning to stitch away stress.
It's been amazing, honestly. It's the highlight of my week.
There it is.
As a volunteer at the nonprofit DeRote, the New York high school student is matched with Laura Lerman for weekly visits and knitting lessons. The organization's mission is to alleviate social isolation for older adults. But Segerdahl quickly discovered the visits lifted her mood, too.
In the winter, when the sun starts setting earlier, I tend to get like a little sadder because there's not that much sun, and then everything just kind of like goes downhill. But I mean, this winter I wasn't really feeling that.
A national survey of American children and teenagers finds those who do volunteer work are in better physical health and more likely to flourish, and less likely to experience anxiety, depression, or behavioral problems.
We often hear, "This has changed my life."
DeRote's Shai Rosenfeld sees the results firsthand.
They report, right, on feeling useful, feeling valued, feeling like they're a bigger part of the community, feeling like they have a better sense of who they are, all these sort of benchmarks of well-being.
The well-being of America's young people is now a top concern for the U.S. Surgeon General, who warned in June of a youth mental health crisis.
It now threatens the foundation for health and well-being for millions of our children.
For Penelope, volunteering is a break from the pressures of adolescence.
I get to go knit after school and kind of just cleanse my mind.
A powerful example of how giving to others can be a gift to yourself as well. Michael George, CBS News, New York.